Welcome to the Medical Staff Voice Live. I'm Dr. Stan Frochtzwajg, Chief Medical Officer here at Community Memorial Health System. And I'm joined today by Dr. Pedro Eva. Welcome, Dr. Eva. So nice to have you here.
Thank you. Nice to be here.
I really appreciate it. And this is our opportunity to get to know you a little bit better. Tell me about yourself. Where are you from? What brought you to Ventura? And finally, where were you trained?
Sure. Yeah, my name is Dr. Pedro Eva. I was born in Jerusalem, actually, so
that's
long
a
way
popular
from here.
place. Yeah, everybody knows where Jerusalem is.
Yeah, a long way from here. And, I went to school there, and then I moved to Spain because went to medical school there in Spain, started medical school. And then I decided, I want to switch to something different. At the time, I wasn't very happy in Spain. It was a different kind of training. So I switched to biomedical engineering and came to UC Davis here.
Oh my gosh.
So yeah, that was fun. I spent 3 years at UC Davis, worked at the UC Davis Medical Center, and obtained my degree as a master's in biomedical engineering. But then, working there in that environment with radiologists and doctors in the field of biomedical engineering, at the same time, I was also volunteering at a clinic there in Davis called the Davis Community Clinic. They treat farmers who speak only Spanish, and so that was useful. It was useful. My language skills were useful there. So that got me interested again in medicine. So I went back to medical school, and I finished in 2000, the year 2000, and then did some training in Hawaii I actually did 1 year of internal medicine at the Cleveland Clinic, and then moved to Hawaii to finish my specialty training in psychiatry.
You said you went back to medical school. Which medical school did you go back to? Spain?
No, what I meant by that, I went back into that field.
Thank you.
Yeah.
Appreciate it.
You're welcome. Yeah, so I went to foreign medical school, actually, St. George University, and part of the training was 2 years in the islands there in St. George and the hospitals there, and then the other 2 years were all some of it was in England. I did about 6 months in England, and the rest hospitals in the U.S. Connecticut, New Jersey, New York, and so it was a good training because you get exposed to different places, different kinds of patients, and it was fun. It was interesting, and I really enjoyed internal medicine. I did 1 year of it, but then I decided, psychiatry is really my field, and so completed my residency in psychiatry. So.
Well, you've been all over the world. What brought you to Ventura? How did we get so lucky?
Yeah, well, thank you. Yeah, no, I love Ventura. I think I'm the one who feels lucky to be here. Ventura is a nice place, nice small town. I was living in Davis 4 years ago, and working at Davis and for Yolo County there. And at the same time, I contracted with a program that did services for San Bernardino County. So I was traveling from Davis, and I did most of the work via telepsychiatry, but I was traveling about every 2 weeks to 3 weeks. So after a while, I thought, I want to be closer. I was in Davis for family reasons. My mother was ill, but then that wasn't the issue anymore. So I was looking around. I really liked Ventura. I looked Long Beach, looked San Pedro, different places. There's nothing like Ventura, so I love it here. Small town, but still nice, near the beach. People are nice, so it's a great place to be.
Well, that's our luck that you got here. So I appreciate that. You are a psychiatrist, and I'm very curious as to what kind of psychiatry do you like to do? Do you treat all ages? Do you like inpatient, outpatient? Do you have an office practice? What type of practice do you have?
Yeah, right now I'm doing mostly emergency psychiatry, consultation and emergency. I work for a clinic that has a crisis walk-in center, so I do 2 days a week for them. So these are patients who are referred by the hospital, by their family members, the police drops them there, So they are people in crisis, and that's why it's called crisis walk-in center. I like that. It's fun, it's always something different, something new, and somebody in crisis. So I do that 2 days a week, and then the rest I'm now dedicated to a community memorial. So I'm available for consultations.
Are you able to do inpatient as well as emergency department?
Sure, yeah.
Wonderful.
Yeah, actually,
wow.
Yeah, we've been seeing patients on the floors as well as the emergency room. Yeah.
And you do the spectrum of psychiatry? Do you take care of various ages, children, pediatrics?
Sure, yeah. We actually, the youngest so far I've seen is 10 years old. So.
Wow, very nice. Well, that's very fortunate for us. When you've been here for a few months now, do you find that the cases and the care that you provide in the emergency room are appropriate and appropriate referrals and requests for consultation?
Yes, definitely. Yeah, I mean, for the emergency room doctors, it's harder to sometimes spend the time needed, to get to know the patients, to build some rapport, to make all these phone calls. Especially with children, you gotta call the parents, the caregivers. The parents are not there, and so it's sometimes we call the psychiatrist actually for the 10-year-old. Talk to the psychiatrist, the social worker. So it's I think it's important to have someone who's available just for that purpose. And the psychiatrist is available when we're asked to do a consult. We cover all that work that the emergency room doctor might find it difficult to invest that much time, with a psychiatric patient, and especially because they have so many other responsibilities, procedures that they got to do. So it's fun to be there in the emergency room too. It's a fast environment, I enjoy it there. It's a lot going on, and the fun part is always meeting with the attending psychiatrist and let them know my impression and what we're thinking and stuff, and meeting with the social worker as well and coming up with a plan. So.
Inpatient, what types of conditions do you commonly treat, and what kind would you like to be involved with?
Sure. Yeah, inpatient, a lot of times patients come in for medical issues, for example, right now we have someone who's pending surgery for diverticulitis, So they come in for those medical conditions, but they do have psychiatric history. And sometimes the issue of decisional capacity comes up, someone who's suffering from psychosis or going through a manic episode, it's common for them to say, no, I don't want the treatment, even though it's risky without the health is at risk without the treatment. So I come in there, try to build the rapport, try to explain the procedure, try to understand the patients, and at times, unfortunately, we have to say that the decisional capacity is not there. We had one patient who we had to say that, but oftentimes with these patients, it helps a lot if you get to know them, you get to talk to their family members, you get to talk to their doctor. They see you as someone who's, spending the time and working with them, and psychiatric patients, they're used to have a lot of people involved in their care. The social workers, psychologists, doctors. So they really are sensitive to someone who is not there just in and out. They're sensitive to knowing that this person actually wants, not to say that the doctors don't want to help them, but they just want, they want someone who can actually be there and spend the time with them, and that makes a difference sometimes.
Well, you certainly are a complementary asset to our other services that you cited, our psychologists,
yes,
our palliative care team, and yes, such. So we're very fortunate to have you. Your practice is really, as you described, in the hospital, in the emergency room, at the clinic. Do you have a private office, or do you prefer to do this kind of consulting work?
For now, I prefer to do this consulting work. I enjoy it more. It's unpredictable. There's always something. So some days it's very busy, some days it's not that busy. So it's more fun this way. Who knows? Maybe in 2 years or 3 years, I want to have my private practice. We'll see.
Yes, of course. Well, I'm going to do a little side turn here and move away from that. What types of hobbies or outside interests do you have that are not strictly medicine or perhaps biomedical engineering?
Yeah, since I moved to Ventura, I joined a CrossFit gym, and it's great. It's been great. It gets you up in the morning. It's every day, 6 in the morning. You do the workout and you feel good for the rest of the day. So,
that sounds wonderful.
Yeah, it's really great. And the nice thing about this gym is that everybody's treated as a family. You come in and everybody's pushing each other, everybody is encouraging each other. So it's really nice. So that's one thing I do. I volunteer, but I haven't volunteered here in Ventura yet. But I've done some volunteer work with a program called AMG, mostly programs that house children with residential programs. I've traveled to the Philippines and volunteered with them also there in a city called Tagaytay, which is near Manila. Right now, of course, we can't travel it, but in the future, I plan to do that as well. So I enjoy that. I also love animals. I have a small dog that I take care of. And
very nice.
Yeah. So that's and outdoor activities, the beach. That's why Ventura is a great place to be. So.
Well, we're glad you enjoy it here. That way, hopefully, we'll get to keep you. That would be nice. Good. Well, we lighten it up even more by going through a segment we call This or That. Now, don't try to analyze it psychiatrically too much. Just whatever comes to your mind. So, early or late?
Early.
Good for you. Pepsi or Coke?
Pepsi.
Corvette or Maserati?
Maserati, I would say.
Oh, I like that. Sophisticated. Christmas or Thanksgiving?
Christmas, for sure.
Very good. Beach getaway or European backpacking?
Oh, beach getaway.
That's why you're here, right?
Exactly. That's why it's Ventura.
Batman or Superman?
That's a difficult one. Superman, I would say.
Okay, I like that positive attitude. Yeah. Hamburger or taco?
I'm a vegetarian, so neither one.
Well, I think they do have some vegetarian tacos.
They probably
but not
do,
many.
Beyond Meat, I don't know.
There you are.
Probably.
Let's see. Well, I'm glad to get that insight into your personality, but most of all, I so appreciate you coming in, helping guide and educate our medical staff and our local community, all of whom will have an opportunity to know you a little bit better and, most importantly, understand the services that you have to provide. Thank you so much for being here.
Thank you. I appreciate Community Memorial. It's a great place to be. Doctors are very much appreciated. I think most of the doctors here do much harder work than what psychiatrists do, and really appreciate them and appreciate their work. So.
You're very, very welcome.
Thank you.
Well, thank you for tuning in to learn more about Dr. Pedro Eva. For more information on all the services and specialties offered at Community Memorial Health System, visit cmhshealth.org and be sure to like and subscribe for more of your community health system. Thank you.
Thank you.